Hello and welcome back to another Voice of Nursing podcast. I'm your host for this episode, Joshua, and today we are joined by William King, who is going to be taking us through his journey as a healthcare professional and how he ended up being here at Clinical 24, which is one of our brands here at ICG. So, yes, welcome, William. How are you today?
I'm good, Joshua. Yourself?
I'm very well, thank you. It's midday here. It's a very good Monday. The weather's great. I can't complain. I
Yeah,
can't
good,
complain
good,
at all.
good.
All right, let's
Yeah,
start. So, William, you began your nursing career as a nursing assistant, and as we've discussed before, you were very inspired by observing registered nurses at work. Can you maybe share some moments or experiences that led you to decide pursuing nursing as a profession?
yeah, I remember it very vividly, actually, that I was, like you said, a care assistant, and I was watching a registered nurse attend to a patient who was severely depressed and couldn't motivate herself to attend to her personal care and assist her. So she was assisting getting her dressed. And the nurse showed no great compassion to this lady at all. And it highlighted bad practice, basically. Even as a care assistant, I could recognise bad practice, and I thought, well, if she can qualify for as a nurse and go through university, I'm sure I can as well. And that was a massive motivator for me, was the actual bad practice of a nurse. So I could better that, I thought, and hopefully I have through my career. Yeah.
Amazing, amazing. When you say bad practice, what was she kind of doing that
Uh,
was bad
uh,
practice?
she just didn't show any interest in the lady. It was a task. She was fulfilling a task of getting this lady dressed rather than
Mm,
actually showing any interest in the lady. And the lady was very reluctant because she was demotivated because she was depressed, and
mm,
that wasn't taken into consideration. It was just about fulfilling the task of getting this lady dressed and probably moving on to the next person. So it was more task orientated than actually person centered care that she was
yeah.
providing.
Yeah, and do you kind of find that to be quite a general a thing that happens, or
Uh,
throughout your career that people just check the task
um,
list?
no, no, hopefully not. I think it was just this nurse's practice, and hopefully she was having a bad day, and it wasn't always like that, you
Mhm.
know. But on this set day, I always remember it was good. But no, I think most nurses nowadays are very patient-centred and person-centred
Mm,
in their care provision, and no longer see it as a task-orientated
mm,
profession.
yeah, yeah. And you mentioned that this patient was dealing with depression, and I know that you've mentioned to me that you've trained as a mental health nurse, to which you've qualified back in 1997.
Yeah.
What drew you to this particular nursing specialization, and what are some of the early experiences in mental health nursing?
Well, in mental health nursing, like you quite rightly said, I qualified in '97, and uh, some of my experiences weren't that nice, actually. But that's part of dealing with uh, people with mental health problems. So um, things like dealing with people who attempted suicide, so finding people who have used ligatures and suspended themselves in bathrooms. That's one of my early career uh, stories. Also, recovering patients from electroconvulsive therapy, which is a treatment that still goes on today, but to a lesser degree, where people get electrodes put to the temples of their head, and which induces a seizure, and
Mm,
the length of seizure results in the uh, progress of their depression. So it's a treatment for depression which is drug resistant, basically. But you can imagine seeing someone getting electric shock, obviously under anaesthesia, isn't too pleasant, and recovering these. But on the positive side, it works, and I've saw many people sort of standard of life improve through getting this treatment. It's just not a very nice treatment to watch.
Yeah, yeah. And tell me, your first job was in secure disability nursing,
Yeah,
right?
yes, it
Uh,
was.
yeah, so tell me, what were some of the difficulties that you encountered in that specific line of work, and how did it shape your view of healthcare profession at the time?
I think in learning disabilities, it was difficult because the level of stress and distress behaviours that were exhibited. So people would call it challenging behaviour. Here in Scotland now, the preferred term is stress and distress behaviours. And every day you went to work and you were assaulted's too strong a word, but
Mm.
you would be subject to being punched or kicked or like slapped
Oh my.
by patients because they didn't know any better, and it was their mental health, and that you were trying to work with them to maintain their dignity, but sometimes it wasn't what they wanted to do, so they protested. And being straight out of university, you thought you could change the world, basically, and you were going to be a super nurse, and you quickly realise, that you have to sort of cut your ideas down a little bit and, be a bit slower
Mm.
in your presentation rather than just having a head full of university work. You actually slow things down and look at the people you're dealing with and look at the person behind that behaviour and why they're
Yeah,
behaving in that manner.
yeah, and I can assume that it's challenging, but you also went through to adolescent psychiatry,
Yeah,
and I think we discussed that's where you sort of felt the love and for that specific area and felt the need to add and contribute more to it. Could you maybe elaborate on how or what appealed to you at the time in this field, and what was the importance of such therapy for
yeah.
young patients?
Definitely the adolescent unit that I worked in was one of 3 in Scotland. So you had a third of Scotland's illest teenagers under your care. So you can imagine um, they were quite ill young people.
Mm,
And what I enjoyed here, I spent 13 weeks there as a student nurse. So I was really, really happy to go back as a staff nurse. And what I enjoyed was they partook in talking therapies. So it wasn't a medical model which had been used in previous jobs or in acute psychiatry. There wasn't a lot of talking therapy there. And you were involved in like family therapy groups. So you could look at the bigger picture for this young person and see how that affected their mental health and work together with the family, because obviously it's quite disturbing for the family as well to have a young person so ill. So you provided support to the family and greater family as well as the young person, and I really enjoyed that element of it, that you could work as a group to better the life of the young person rather than just be a nurse and medicalise their condition.
mm,
You looked at the greater parts of it, and that could be socialisation, it could be taking them to the cinema, so they had normal aspects of their adolescent life as well, which was really important.
Yeah. And just a side question, was there a lot of work done around that area of nursing at the time?
It's vastly grown now, child and adolescent mental health, quite rightly so. It was a much needed growth, and I'm really happy to see it grow. There wasn't at that time masses of work, and you found that a lot of the young people who had eating disorders were going to adult wards rather than having like adolescent service wards or children's nurses who were aware of eating disordered children and the trials and tribulations that they went through with their condition.
Yeah.
So it's much better now that we've got joint working with paediatric teams as well as mental health teams, which really wasn't there in my day of working there.
Yeah. And going into caring for children with eating disorders, sort of moving into adult care, because I know that we've mentioned this, or you've mentioned it before, that they were sort of put into adult care instead of having their own sense of care. Sort of how has your experience in this field shaped your approach to caring for pediatric patients?
I think as a mental health nurse and a paediatric nurse, I've always looked at the mental health aspect or the effect of emotion on the patient, even with a physical condition. When I moved to paediatrics, I was always aware that it was stressful for the patient. They were out of their comfort zone. They were in hospital. They didn't have maybe the toys or the game consoles that they were used to, so they were bored, and it was about providing a social aspect to their time in hospital so they didn't feel bored. It was supporting parents again who had sick children and the anxiety of that, and letting them know it was okay to go and have a cup of tea, or where a lot of parents would spend time at the bedside, and you would have to support them and saying it's okay. You need to keep yourself well as well. You have to have something to eat and drink. So we'll watch your child. Your child will be okay, and while you're away, and reassure the child that it was mum had to go for something to eat, and that's where you might use a play therapist or another member of staff to support them, the child, and spend time with the child well. And it's massively important to see the whole picture of the psychological well-being of a child as well as the physical well-being of the child as well.
Yeah, of course. And you also went into intensive care, and I think you mentioned that you were there for 6 years, and you
Yeah.
also noted it was quite a demanding role, and maybe just tell us a bit about what skills and qualities you sort of came to understand were most critical for nurses or for yourself in those high pressure environments. And I can imagine it was also very challenging. So how did you go about with those challenges?
Most of my career has been intensive care, either paediatric intensive care or neonatal intensive care. And it is very challenging. But again, it comes down to support. And it goes back to sort of my answer, it's like supporting the child when they were awake, if they were awake, and they weren't like on medication that made them sleepy or sedated, and supporting a parent through and explaining everything that was going on to a parent. And some of the challenges were simple things like children didn't understand the lines and wires that they had on them, so they'd try and pull at them. Do you know, where in an adult intensive care, you can tell the person, do you know, this is for this is for that, do you know, and they understand. But a 2-year-old child who's went under cardiac surgery, because the unit I worked in was Scotland's cardiac surgery unit for paediatrics. So a lot of times they'd have drains in their chest, and impulse on a child is to, if they don't want it, they'll pull it away and try. So trying to prevent them pulling drains out, lines off, like drips out their arm, things. And it was doing it in the most humane way, but keeping that patient safe, you know, and explaining to parents the needs of these things initially, and getting them away as soon as possible. So as soon as you could take that drip down, get it away, so it was one less thing distressing for that child, and again for the parents, because, you know, again, it's about seeing them as a family group, you know, and supporting the family rather than just the parent or the child. So yeah, it was a very challenging role, but a very interesting role as well. And sometimes I do fondly think about it and miss it a little, do you know, but, do you know, it's a part of my career that I have done and I've moved on from.
Yeah. And then you also eventually moved into home care. What was the motivation behind this change? And, you know, how did it feel to return to a role similar to where you began as a care assistant?
Right. So I moved to care homes after being in the NHS service for approximately 20 years. And if I'm being very, very honest with you, I was a bit disillusioned by the NHS at that point. There's been lots of changes. So I moved back to care of the elderly in care homes, and I went as a unit manager. And although I can see the similarity of it being care of the elderly, like you said, it was a very different role to being a care assistant. The client group was the same. The responsibilities were very different, and being in private healthcare as well, you had to have a different outlook as well, because sadly, there's financial implications of it, you know, in healthcare, where the NHS, you never really saw the financial implications of it to a great degree. So yeah, I was always interested in care of the elderly. It's where my career started, and I enjoyed care homes. I started in care homes as a unit manager and ended up as a care home manager, and looked after numerous care homes as a care home manager, registered with the Care Inspectorate. So yeah, it was good. It was challenging, and it went back to mental health, and at a point that I thought, this is real nursing care that you're providing, basic nursing care to people who have offered so much to society. Like being able to sit with people in a care home and hear their stories, and because they have a cognitive impairment or a mental health issue, you could still sit and learn from them, you know, and learn a great deal from their attitudes. And I enjoyed that aspect of it. You know, again, it was giving them time and giving them social time and listening to people. You know, and I think communication in mental health, nursing and paediatric nursing or children's nursing is forefront to everything. Do you know,
Yeah.
because if you can't communicate and make your care known, do you know, that's how, like, if we're going back to the previous question, you end up getting a slap or a punch because you've not
Yeah.
made yourself clear on what your intentions are. So communication is like extremely important, and that's what I did enjoy about my time in care homes.
Yeah. And I think I would also like to know, like, sort of how did you end up coming to ICG? And for those of you who are listening into this podcast, ICG Medical is a healthcare recruitment agency that has namely three brands. And as we've pointed out before, William, you work for Clinical 24, and
Yeah,
Voice of Nursing also falls under the ICG Medical brand and umbrella. So yeah, tell us about how you just came to stumble on to ICG's doorstep.
yeah. This is a really bizarre story because I was on holiday and in Gran Canaria, and I got a phone call asking if I was interested in a post of manager for Scotland, and I was totally unaware. And management in ICG had found my CV and made the call directly. So as I was on holiday, I was like, I can't really interview at the moment. So after I came back again, another phone call and interviewed, and I was like, yeah, it sounds interesting. It was an ideal time for me. I had went through all the trials of COVID um, and the in care home settings. And for anyone who's listening to the podcast, will know fine the trials and tribulations of the COVID pandemic on
Mm,
care homes, especially. And I was ready for a move, and the call from ICG couldn't have come at a better time. It wasn't an area I was aware of. I had never worked in an agency previously, and it's different, but it's exciting. It's every day is different for me. There's not 2 days the same in my role as a registered manager, and you still have an element of care because you're looking at policies, you're looking at
mm,
standards of care provided by the staff that work for us, and ensuring that that reaches like the best standards ever, looking at best practice statements. Do you know, so there's a lot of reading and knowing the importance of best standards and how you can portray that to the staff that work for you. So
mm.
yeah, it's a really interesting post. I've now been with ICG or Clinical 24 for a year, and you know, I'm still learning. It's a massive learning curve, but a really interesting learning curve, and really grateful for the opportunity that was presented to me while I was on holiday. Yeah.
Yeah, so I mean, someone who's been through numerous phases in your career, what kind of advice would you have for new nurses who may be considering different specialities or seeking to broaden their skill set?
I think all nursing goes back to um, thinking about the person that you're caring
Mm,
for, and
yeah,
recognizing it's a person that you're caring for. It's not a task. It's not a job list. There's a person at the end of that care, and how you react to them, how you communicate to them can have consequences forever. Do you know,
yeah,
a good experience with a good nurse will always be remembered, as will a poor experience with a nurse always be
yeah,
remembered. And the latter doesn't do anything for the profession. and nursing has fought a long time to be recognised as a profession and have standards recognisable that it is a good profession to be in, and care of the person rather than a diagnosis or a tick box exercise. I would say that is the most important thing, is looking at your patient and seeing them as a patient and a person that you can work together to gain the best sort of outcome together for them.
Yeah.
It should be a collaborative thing. It shouldn't be a nurse dictating to a patient what they need. It should be the patient dictating to the nurse what they want and working together to achieve that for that patient.
Yeah. Yeah. So true. Well, William, thank you so much for joining us here at Voice of Nursing. It's
That
been really good to chat to you, and yeah, I'm very impressed with everything that you've done, and it's so good to have you on our team. Hear great things about you here at the Clinical 24 team. So yeah, and for those of you who have been listening, we thank you so much for tuning in to the Voice of Nursing. We'll catch you later on with another episode. Bye.
Thanks. Bye. Bye-bye.